there is many reasons why suddenly the patients may develop a lump in the area of head and neck. The most common cause would be an increase in size lymph node, and we have many lymph nodes both under the skin and also on the deep areas of the neck. Lymph nodes are part of our immune system, so they could swell up naturally as a healthy response to an infection or an inflammation, or they could increase in size and swell up because of other different conditions, because of the immune system, because of a systemic disorder in the blood like lymphomas or leukemia. And most importantly, with the head and neck area, it could be a sign of cancer. There is another reason why the lumps may appear in the head and neck, and that's completely separate to what we call lymph nodes. They could relate to salivary glands, and salivary glands are everywhere around the head and neck area, especially the parotid sides on both sides, and also under the jaw. And sometimes salivary gland abnormalities like obstruction or blockage because of a stone or because of a tumor arising inside the salivary gland may be responsible for a lump in the head and neck region. It is important to seek for medical advice every time someone identifies or feels a lump in the head and neck. Most importantly, if the swelling persists for over a week and is not related to any recent cold like sore throat or an infected tooth, then medical advice and appointment with a doctor is advisable. So there is a triad in diagnosis of head and neck lumps that is based on a concise and comprehensive history of the symptoms and medical history, also on clinical examination and additional investigations such as ultrasound scan, imaging studies like a CT scan or MRI scan. So in order to reach a diagnosis, we will need to have the history of the symptoms arising from the lump, and also a very comprehensive and detailed clinical examination, particularly in relation to any infections in the mouth or in the throat, and additionally specific and targeted appropriate scans. In some occasions, we may require taking a small sample like fluid from the lump and sending it to the laboratory for appropriate investigations such as cytology, histology, which means a form of biopsy, or even microbiology studies. The treatment options will relate to the diagnosis. So in a very simple scenario, if a head and neck lump, after all the investigations, is proven to be completely benign, they may require no treatment at all. In some occasions, it could be medication treatment or sometimes addressing the cause of the lymphadenopathy if the lump is a lymph node that responds to a certain infection. In many other occasions, if the lump arises from a salivary gland, the treatment may require surgery, but this has to be done by a specialist surgeon who specializes in treatment of head and neck lumps. In very rare occasions, if the lump is related to mouth or throat cancer, then the treatment has to be far more comprehensive and in a what we call it multidisciplinary team fashion meeting, as it will have to address the primary cause of the lump, which is treatment of the underlying cancer. So the general advice is a healthy lifestyle with good nutrition and avoidance of any harmful habits such as smoking or excess alcohol drinking. This refers to everyone. Very rare, a lump could be related to sun-damaged skin and skin cancer that has metastasized to a lymph node. So again, ultraviolet or sunlight protection is quite important. But certainly anyone can develop head and neck lump. So most importantly is to seek for early advice when someone is worried about a new lump in the head and neck.